days, the drugs that we use are really very well tolerated, and they are incredibly effective at controlling blood pressure and, importantly, in reducing the risk of stroke and heart disease later in life.
Varicose veins are swollen veins that appear lumpy and blue through the skin. Any vein in your body can become varicose, but the veins in the legs, particularly the calf, are most commonly affected. Varicose veins are a common condition affecting both men and women. So what causes varicose veins? Blood travels around your body through blood vessels. Arteries carry blood from the heart to the rest of the body, and veins return blood to the heart. When your leg muscles move, they squeeze the leg veins and help to push the blood upwards to your heart. Inside the large veins of your body are one-way valves, which stop blood flowing backwards in the wrong direction. In varicose veins, the walls of the veins stretch and become less flexible, which weakens the valves and stops them from working properly. Blood then leaks backwards and builds up in the vein, causing it to swell. The reason why your veins and valves stretch and stop working is not fully understood. But common risk factors are obesity, having an occupation that involves standing a lot, and pregnancy. If your varicose veins cause complications, such as inflammation or bleeding, your skin changes or ulcers start to form, your doctor may recommend surgery. The most common type of surgery is called ligation and stripping. In this procedure, your surgeon will make a small cut near the groin at the top end of the varicose vein, and another one further down your leg by the knee or ankle. The vein is cut and tied near the groin. A thin wire is inserted through the vein, and the vein itself is carefully pulled out through the lower cut. Removal of varicose veins does not affect the blood flow, since other veins take over their role. Even after surgical treatment, there is still a risk that varicose veins may come back. Other available treatments include sclerotherapy, where the affected vein is injected with a chemical to seal it closed, and new types of treatment, such as laser and radiofrequency ablation therapy.
Tuberculosis, TB, is an infection which you catch from other people. It's usually caught when other people cough up the germs and they then get breathed in and infect the lungs. Now, with the great majority of people who get infected with TB in this way, they don't progress to become ill at that stage. If the immune system is depressed in any way, they're more likely to progress to get active disease and become ill with TB. The lungs are the commonest site to become ill. And the sort of symptoms that people get are a cough, which just won't go away, but particularly feeling tired, feeling run down, fevers, sweating particularly at night time, and losing weight. TB can spread from the lungs, either at the time of being first infected or at other times, to affect other organs, most commonly the lymph nodes. Often swollen glands in the neck are the result, and less commonly to other places like the brain, giving TB meningitis, the bones, particularly the spine, giving bony tuberculosis, and sometimes the kidneys and other organs. Tuberculosis is nothing like as common as it was before the introduction of effective anti-TB drugs in the early 1950s, but it's still a fairly common disease, particularly in our inner cities, and we've seen quite a big increase in tuberculosis in the UK in the last 10 to 15 years. Now, absolutely anybody can catch tuberculosis. It's generally the case that the healthier you are, the less likely you are to become ill with tuberculosis. Let's say that you actually get infected with the germs, you're much more likely to fight them off if you're in generally good health. Now, of course, there are some very specific things which may make you particularly at risk. For instance, HIV infections, diabetes, renal failure, and particularly being treated with anti-cancer drugs or being ill with some sorts of cancer can increase the risk of latent TB infection, making you ill with active TB. There are two main ways of preventing tuberculosis. BCG vaccine is a living, weakened form of the TB bacterium, and it's given to people so that it's strong enough to stimulate their immune system, so that when in the future they come across tuberculosis, they've got some resistance against it, but it's not so strong that it makes people ill. And it's about 70% effective in people with normal immunity. The other thing is an awareness of what the symptoms of TB are, because the quicker that someone is diagnosed with TB, the less likely they are to pass it on to other people. There's both bad news and good news about tuberculosis. The bad news is that if it's not treated, it's got about a 50% chance of killing you. The good news is that if it's diagnosed and treated, you're virtually guaranteed to be cured. TB bacteria don't respond to conventional antibiotics. You have to give special anti-TB antibiotics. So being on the lookout for tuberculosis and getting on the treatment, and crucially taking the treatment right the way through the course, which can be 6 months, sometimes longer, can give you a much better outcome than the pretty gloomy prospects that people had from tuberculosis in the past.
Hello, I'm Dr. Rupal Shah. I'm a GP in Battersea in London at the Bridge Lane Group practice. So measles is a viral illness. It's spread through droplet transmission, so air-to-air contact. It presents with a fever, cold symptoms, and then a few days after those symptoms first appear, you tend to get a generalised rash. You may also get little spots in your mouth, just in the inside of your cheek, which are little red spots with a white head called Koplik spots, and those are very diagnostic of measles. So if you haven't had measles before and you haven't been vaccinated, then it could affect anybody, children or adults. It can be quite a nasty illness. You know, people are usually quite unwell during the acute phase when they've got the high fever, and just before the rash develops. It's really quite a nasty, unpleasant sort of illness. It can lead to other complications, and probably the most common one is a pneumonia, so a chest infection as a result of the measles. For uncomplicated measles, there's no specific treatment because it is a viral illness. If you do develop another complication, like pneumonia, then you might need antibiotics to cover that. If you make sure that your child has been immunised with the MMR, so measles, mumps and rubella vaccine, and gets both doses at 13 months and again between the ages of 3 and 5, they should be immune against measles. If your child hasn't had MMR, but you know that they've been in contact with another child who has got measles, then you should go and see your GP, because giving the MMR within 72 hours of the first contact might result in your child being immune to measles. Hello, I'm Dr. Rupal Shah. I'm a GP in Battersea in London at the Bridge Lane Group practice. Mumps is a viral illness, and it tends to present with a high fever and pain just around your jaw, around the angle of your jaw. Could be one side or both sides, some pain and swelling. So it's a viral illness, and you usually feel really awful for a few days with it. Anybody who hasn't been immunised could potentially catch mumps. It's quite an infectious disease, so if you have got it, then you are quite infectious to others around you. So it can affect adults or children who aren't already immune. If you've had the MMR vaccination and you've had your booster of that, then you should be immune. Because mumps is caused by a virus and not a bacteria, you can't treat it with antibiotics. It's usually just symptomatic treatment, so painkillers for the pain and paracetamol for the fever. So there's nothing specific that you need in terms of treatment. Although mumps is usually self-limiting, sometimes it can cause other complications. Most well known of those is probably orchitis, in which a male will present with swelling of the scrotum and pain, usually a few days after the jaw symptoms first appear. Sometimes this can lead to fertility problems, especially if you get mumps after adolescence. Meningitis is another complication of mumps, which is fairly rare. If it does happen, it's usually self-limiting. Occasionally it can be more serious or even fatal. I would say that the best way of preventing mumps is to make sure that your child does get the MMR vaccine. That's given in 2 doses, once at 13 months roughly, and then another booster dose between 3 and 5. If your child's had both those doses, then they should be protected against mumps.
Hello, I'm Dr. Rob Hicks and I'm a GP working in London. Scabies is a very contagious skin infection which causes intense itching all over the body. It occurs when the scabies mite burrows into the skin, eating its way into the skin. It then in the burrow lays eggs which hatch, and of course when these hatch the new mites perpetuate the infection. Scabies is actually very common. It's more common in children and in women. It's more common that people get it from schools and those living in nursing homes because it's close proximity, close prolonged physical contact is how people catch scabies. It also tends to occur in the winter time, again because people are spending more time indoors in close proximity with each other. But I think it's very important to highlight that it's not related, or there's no scientific evidence relating it to poor living conditions or poor personal hygiene. Scabies, the mite will infect anybody, it doesn't mind. Now, how people get the scabies infection is through prolonged close physical contact. The mite can't jump and it can't fly. So we're talking about things like prolonged hand-holding, sexual intercourse, sharing a bed with somebody, for example. Now, thinking of the symptoms of scabies infection, obviously it's intensely itchy. People just can't settle and they're often clawing at their skin. This itch is worse at night and certainly after a hot bath or shower, and often you find red blotchy marks on the skin and the little lines where the mite has burrowed into the skin. Now all these things help the doctor diagnose scabies. If somebody says they've got intensely itchy skin where they can't get relief, you think, haha, could be scabies. Examine the skin and you may see the red blotchy marks and the thin lines, particularly in the warmer areas of the skin, and that's where the mites like to be. So in skin creases, between the fingers, under the nails, for example. And then if somebody says that somebody else within the household also has very itchy skin, then that adds weight to the probable diagnosis of a scabies infection. Now, it's good that treatment of scabies is relatively straightforward. We recommend using a cream that's put all over the body that contains an insecticide that kills the mite, and it's recommended that this treatment is repeated 7 days later so that any eggs that have hatched in the meantime also get killed by the insecticide treatment. Very important also that somebody's given a treatment to relieve the itching, a cream or maybe an antihistamine tablet, which may also help them sleep at night and get a decent night's sleep so they're not feeling tired the next day. Also very important that other members of the household are treated or sexual partners are treated, even if they haven't got symptoms, to reduce the risk of the person becoming infected again. Good idea to boil wash household linen, clothing, bed linen and towels to make sure that any mites that have survived on these articles are killed, and boil wash more than 50 degrees centigrade. What's very important is that scabies is a very common infection, easily treated, and people shouldn't be embarrassed about asking for advice about it. And they can get this advice from their local genitourinary medicine clinic or sexual health clinic, certainly from their GP or their practice nurse, or they can pop into their local pharmacy and ask their pharmacist for advice.
I'm Robert Fluin, I'm 19 years old, and when I was 8 I was diagnosed with vitiligo. It's a skin condition. It relates to the pigment in the skin. It's when there's sort of a lack of colour, basically. It first appeared on my torso and on my shins of my